Very hearty good afternoon, everyone. We are glad to have Dr. Ramya Mishra among us today to help us understand the topic which is blocked fallopian tubes. When diagnosed with blocked fallopian tubes, a lot of thoughts flood one's mind. Most common will be like, will I able to be conceived? The doctor will help us understand more about this condition and tackle the issue in detail. So, doctor, you have the stage.
Thank you for this. So today we are here once again to discuss about the fallopian tube. So it's only the blocked cases ones. See, first of all, we should know what is a fallopian tube. See, fallopian tube is a muscular structure which is a part of internal female genitalia, which is basically used for the fertilization of the embryos. Okay. So, as I told you, it's a muscular structure which is attached from one side to the uterus, and on the other side, it is in connection with the ovary. So, it functions as a bridge for the eggs which are released from the ovaries. They are picked up from the last end of the fallopian tubes. They travel through the tubes and they reach in the ampullary portion of the fallopian tube. And then when the sperms come there is a fertilization process which takes place. And then again, there is the division of the embryo which happens in these tubes, and this comes back to the uterine cavity, and the implantation happens. So it holds a very significant role for the couples who want to conceive. So that is why I started from here. What is a fallopian tube and what is its function? Because the vitality of this organ is recognized only when we know the function. So this has got a very important role to play in the process of fertilization, in the process of reproduction. Because in many couples we see these days, this is a very common cause. They come to us with all the reports, all sorts of reports, and when we see them, then this contributes to around 30 to 40% of the cases for the infertility in the infertility patients. So this is a very important. We need to diagnose at the right time. We need to focus on the causes. We need to know the reason why it has happened, and what are the treatment options we can provide to them.
Yeah. How it is blocked? Like, is there any reason? Because, to just, to have it in mind, like, to all these things. Because young
Yeah.
couples these days have all planned things, right? So, is there any precautions people should take?
See, there are multiple reasons for a patient to get a blocked fallopian tube. You may not be knowing it, and later on in life, when you plan a pregnancy and when you are subjected to all sorts of tests, you will get to know that there is a tube which is blocked. So, the reasons could be ranging from infections, especially we have something called PID, pelvic inflammatory disease, wherein you have some kind of infections like some bacterial infections, chlamydial infections, or gonorrheal infections, which can travel from the lower genital area and go up to the tubes, and they may cause this scarring of the fallopian tubes. So this may give rise to a blocked fallopian tube later in their life, and they may have difficulty in conceiving. The second most common cause, which we see, the other common cause out of the other common causes, is the tuberculosis. Tuberculosis is a very common cause of infections, genital infections in Indian females. We call it as like if every in 25% of the cases we find that tuberculosis is the cause. So if a female has any kind of tuberculous infection in her body, be it their lungs, be it their abdomen, be it their bones, or anywhere in the body, so their genital organs, and specifically fallopian tubes, are the first organs to get affected because there is a hematogenous spread. There is a spread of this bacteria from the blood which goes and infects their tubes. So later in life, when we see infertility patients, this is the most common question we ask. We always ask, "Have you ever underwent any tuberculosis treatment?" Because if they have this kind of history, we assume that their tubes may be blocked because of this cause, and because of this, they may have a blockage of tubes. They may have hydrosalpinx into their body, and this later on affects their uterine structures also, like we call it endometrium. So that also gets affected later on, so they may have difficulty in conceiving. Apart from tuberculosis, if there's something called endometriosis also, it's a inflammatory disease which is seen in some females, wherein some inflammatory markers are released and you have the architectural damage is there. Like the normal architectural position between the ovary and the fallopian tubes get distorted, and that is why there is a difficulty in getting the egg from the ovary to the fallopian tubes. So endometriosis is also a very common cause of distorted and blocked fallopian tubes. Apart from that, if you have any history of ectopic pregnancy and you have underwent surgery for that, that also is a major cause of blocked fallopian tubes or non-functioning fallopian tubes. If your uterus has got a fibroid which is near the connection where the fallopian tube is attached to the uterus, there also that obstruction may give rise to, it will be difficult for the sperm to go and fertilize the egg which is there in the tube. So that is also physical hindrance or physical blockage to your tubes. So these are the common causes which we all should, if you have seen any of the causes in your body or any symptoms like you feel these are symptoms, in that case you can be cautious and you can get yourself checked at the right time when you are planning to get for pregnant or for your fertility status.
He is not actually giving me any details.
Doctor, how to in general unblock the fallopian tubes? Like, what is the process? Like, for a person to understand in a very easy and a very informative way, educational. So, how to unblock a fallopian tube?
See, first of all, it is important to diagnose it. When you diagnose that there is a blockage in the tube, then only you can go for the, how to unblock it. Okay. So the blockage can be, it can be small adhesions or some subtle adhesions which are there and which are very flimsy. So they can be easily broken up. So these are the blockages which can be diagnosed when there are three main procedures which we use to diagnose a blocked tube. One of them is HSG, hysterosalpingography, wherein we put iodine dye into the uterus of the female, and this dye is injected from the lower part of the vaginal area from into the uterus, and the dye which is flowing from the uterus to the tubes, they are subjected to X-ray exposures. So that X-ray films are taken up, and you will see the flow of the dye or the uterine cavity or the tubes in the ultrasound in the X-ray films.
Okay.
So this is a way of diagnosing a blocked fallopian tubes. In case the dye is not able to cross a particular area, we say that yes, this part of the fallopian tube is blocked. The dye is going up to this area, so this is blocked. Or you can see if the blockage is at the distal part or at the end of the fallopian tube, and there is some accumulation of fluid, or there is dilated tube also. Then there also you can see that the dye is there, which is uh, excuse me, there is a dye which is accumulated in that particular area. So we can, excuse me,
Yeah.
we call that there is a hydrosalpinx or there is a fluid which is accumulated, before the blockage, and they can be seen completely on the HSG film. There is another way but this procedure we call a bit painful, and you may use a simple sedation or you may also use anesthesia if the patient wants that. You may give simple antibiotics to the patient, and then we can later on we can let the patient know what is the problem and how to treat that one. There is another way by which we do is sonosalpingography, that is done with the help of an ultrasound and a normal saline. So this is completely less invasive, less painful. There is no exposure to the X-ray films in the X-ray radiations in this procedure. So this can be also used to diagnose the blockage in the tubes. And there is one more way, which is the most diagnostic one, is the laparoscopy. You can use a laparoscope in which the camera is inserted through the abdomen, and you can put the, we call that process store perturbation also, wherein you instill some kind of dye from the vaginal area and the uterine part, and you can see that dye coming out from the tubes through the telescope which has been through the camera which has been put through the abdomen. This we call laparoscopy to diagnose the tubal blockage. And if we find some kind of blockage, then this blockage can be treated in the same sitting. So we always say that when the blockage is only mild or it is in the initial stages, this pressure of the fluid or the dye can be used to clean it up. and you can get, the pregnancies are possible in the subsequent cycles, in the subsequent 2 to 3 cycles. There are more chances of getting a pregnancy. But in case the adhesions or the blockage is very strong and you're not able to clean them up, or it is not able to clear out, then we counsel the patient as to how they have to move about. So these are the few things I think they use to diagnose the blocked tubes. And once you know that your tubes are blocked, you have to consult your fertility expert. What is the next step out? Now
So,
you
doctor, we
asked
have.
about the unblockage of the fallopian tube. So as I told you, if unblockage can be done in the same sitting, so we call that tubal recanalization. So when we go for tubal recanalization and you conceive in the next 3 to 4 cycles, then it is fine. But there is something called celial function which is there in the fallopian tube. So the celial function is lost. So despite opening the fallopian tubes also, sometimes there is a difficulty in conceiving, and then these patients should be counseled for the process of in vitro fertilization or IVF process.
Okay. So, doctor, we have some questions. There are three questions. I'll just show.
Yes, please. What are the reasons that blocks fallopian tube? Santosh, I just cleared these points. What are the common causes for a blocked fallopian tubes? Like I told you in the initial part of this session, that we have many reasons. The most common being tuberculosis, pelvic inflammatory diseases. There can be, endometriosis in your body, in the female body, which can give rise to, distorted architecture between the ovaries and the fallopian tubes. You may have simple hindrances which may block the tubes in the form of fibroids, which can be near the tubal ostia, or you may have some inflammatory diseases like chlamydia or gonorrhea infection. These all, or a history of ectopic pregnancy may also be a cause for a blocked fallopian tubes. I hope I've answered your question. Do we have more questions? What are the signs and symptoms of blocked fallopian tubes? See, sometimes the patient may not at all know that they are having blocked fallopian tubes, because this is sometimes a completely silent disease. So, if you have a history of getting any kind of tuberculosis in your younger years of life, like in the teenage or in the 20s, then you should be aware that yes, your tubes may be affected, and you should try for your, if you're planning a pregnancy, then you should look into that matter as early as possible. So sometimes patients get to know about their blocked fallopian tubes only when they start planning for a pregnancy. So that is why the awareness amongst population is very important, because once the tubes are blocked, you will be having difficulty in conceiving. Okay, so if yes, if the blockage is too much and there is accumulation of fluid through the that blockage area, and that gets infected because of some kind of infection, then you may have pain also. We call that hydrosalpinx. Okay, or if you have some pus there, forming pus in the pockets of your fallopian tubes, then you may have a pyosalpinx. You may have mild grade of fever, lower abdominal pain. Sometimes bleeding or spotting may also be there if that is too much in the uterus. Also, you may have irregular periods also, or you may have less periods also. If that infection has affected your endometrium or your uterine lining also, because in later part of the tuberculosis, your endometrium gets infected, your endometriums get stuck together. We call that adhesions or synecdoche, and you may present in the form of having less periods or less bleeding, or sometimes not even there's no bleeding also. So we call it amenorrhea. So these are the symptoms which usually are there, and infertility being the most common amongst the reproductive age group. How do we test for blocked fallopian tubes? Hello, Akriti. I have already, I think you joined us late in the part. So in the initial part of session, I explained how we can go for we can check about the blocked fallopian tubes. So briefly explaining you, we have mostly three simple procedures to check your fallopian tubes. First of all, you can go for an HSG, which is hysterosalpingography, which requires the use of a dye, which is put into the uterine cavity, and then this dye is seen going through the tubes and the uterus, and this is subjected to an radio X-ray film exposure. So you have exposure to your radiations in this procedure, a bit painful procedure, but can be done under sedation or as per the demands of the patient. We have another procedure called SSG or somosalpingography, where you can use a saline to see the tubes under ultrasound guidance, which is less invasive, less painful, and which can be done in the OPD settings also. So this we can do. And another is laparoscopy, wherein you can subject the patient. You can put we put a camera from the abdomen, and we see the dye is injected from the lower part of the vaginal area into the uterus and the fallopian tubes, and we see them directly from the laparoscope. We see the tube, we see the flowing of dye. We can take the picture also for this, and we can check out the tubal status in these conditions. I have answered you, Akriti, well. There is a question. Yes, there's a question from Lydia, which is asked that what is ectopic pregnancy? This is a very important question because once we come across patients with blocked fallopian tubes, or there is a partial damage in one of the tube, partial blockage in one of the tubes. So these are the patients which have they are most likely to get an ectopic pregnancy. See, like in the initial part, I told you that fallopian tube is the place in the body where there is a formation of the embryo. The fertilization happens in the tubes. Then, after the division starts, this embryo comes back to the uterine cavity, dividing into things, and this comes and implants in the uterine cavity. But in case you have a tubal infection or you have a blocked tube on one side and then partial blockage on the other side, then we have something called cilia in our tubes also, and these cilia stops functioning. So like a sperm can move, the embryo cannot move. So this has to be propelled with the help of these cilial things. So if there is a damage in the tubes because of some infection, this embryo may not be able to come back to the uterine cavity. That travel part is not there, so it gets lodged in the fallopian tube itself. And when it starts lodging there, implanting there, since there is a very less space there, so this tube may get ruptured. So that implantation, that pregnancy, when it happens in the tube, we call it ectopic pregnancy. That is, it is not at the right place it is supposed to be there. So if you have ectopic pregnancy, it's a medical emergency, and if it is it has ruptured, or if it has been diagnosed at the right time, which these days we can very easily diagnose when once a patient comes to us with an UPT report which is positive, and there's pain in the abdomen or bleeding, or there is some other symptoms, then we can do an ultrasound and see if there is uterine sac is there or not. If we are not able to find any sac or the embryo in the uterine cavity, then obviously that pregnancy is somewhere outside, and we label it as ectopic pregnancy. And the most common site being fallopian tubes only, which happens in the patients of blocked fallopian tubes or infected fallopian tubes. So this is a very important question. You have to know, you have to let your doctor know that yes, I had a history of tuberculosis or any kind of infections, and this can be the likely thing which can happen. So it can be timely diagnosed, and you will be given the right treatment. Because if it ruptures, then it becomes a surgical emergency. You have to be taken up for surgery to save your life also. You may need to give some blood also. Blood is also required if there is a lot of hemorrhage which has happened from the ruptured tubes. Is it possible to have a normal pregnancy if one tube is blocked? See, if we all like I told you now also, if we have blockage on one side of the tube, then and the other side is completely open, then yes, there is a likelihood of getting a normal pregnancy. You can have a pregnancy, but we always say that in that case, see, if infection is there in one of the tubes, there may be some infection in the other tube. Okay, because blockage is the end stage. Once the blockage is there, that means it is completely done. Before that, multiple steps are there. So those steps have already taken place, and then you have got a blocked tube. But in case the other tube is open, which is there, it may not be functional. So which stage it is in, nobody can diagnose. Okay. So you may have a natural normal pregnancy even after you have one blocked tubes. But yes, you have to know, you have to be cautious. As soon as you get a positive result, you need to check with the doctor with an ultrasound whether it is at the right place or not. First thing, and if you are not able to conceive despite having a normal one of the tube which is normal, and you have to check in your ovarian reserve also, your age also, to get the right treatment at the right time, because your eggs are very important. They should not be washing out from the body in order, and you're just waiting for the natural conception. Uh, can an open fallopian tube be non-functional? Yes, yes. This is a very intelligent question. I would say, Sudipta, you've asked this question. Open fallopian tube in non-functional. Yes, there are two things which are very important. One is tubal patency, which is the open tube, and one is tubal function. So we always say that tubal patency means tubal patency testing. Whatever tests I've told you about checking whether the tube is open or not, so they're just letting you know that it is open or not. Okay, whether it is functional or not, as in function means the propulsion of the egg from the from the ovary to the tube is a very important phenomenon. Whether that is happening or not, that we have no tests to know. Okay, we don't have any tests to know. That we get only to know when you are having open fallopian tubes, you have functional, you have patent tubes, and still you are not able to conceive. Then we find that yes, the tubes may not be functional because of the damage which has happened to the cilia which are there. So this is a very important thing. They say your tubal function is more important than anything else. Your tubal patency is not at all important. It is, yes, it is important, but it has to be functional. Then only it can get you a viable pregnancy at the right place. I went through laparoscopic surgery last week. I had hydrosalpinx on in right side, but my left tube is patent. Can it be non-functional? Yes, definitely. When you went laparoscopic surgery and your one tube was, right side, you had a hydrosalpinx. So I hope your doctor must have either removed it, because hydrosalpinx, if it is there, it is not going to give you a viable pregnancies. Many studies have shown this, that even if we go for an IVF process and we have a patient who has got a hydrosalpinx, and we go for an embryo transfer in that case for IVF, then that IVF process itself will get a result which is half the normal cases. Okay, because that hydrosalpinx fluid is embryotoxic. So this will never let your embryo grow into the uterus, and you may not get a positive IVF outcome. So if you have a hydrosalpinx which has been documented from in the laparoscopic surgery, so it has to be taken out, one thing. And if the other tube is patent, so yes, you can give a trial for a natural pregnancy, but you have to be cautious about your reserve, like I told you earlier. Like your reserve is at what level, like if you have a low ovarian reserve, in that case you should resort to an IVF process, wherein the eggs will be taken out from the body, sperm will be taken from the husband, embryos will be formed, and you can get those embryos transferred into uterus. So that really helps you if you are not able to conceive despite having a open tube, one functional tube. How can we know tubes are functional or not? See, Sudipta, there is no way to know whether the tubes are functional or not, because that we get only, like I told you, it's a only retrograde thing. Okay, if despite patent tube you are not able to conceive, then that is categorized as unexplained infertility, and the obvious cause most commonly is the non-functional tubes, and the treatment plan for that will be definitely subjecting you to IVF process, wherein you don't need your tubes which are functional. Do we have any more questions? Yes. My doctor just disconnected the right tube which had hydrosalpinx but did not remove it. Is that okay? Yes, even if it has been disconnected, that is also fine, not a problem. If the doctor has only disconnected, that means that hydrosalpinx fluid will no more come to your uterine cavity and will no longer affect the embryo condition. So that is also fine. The only thing is that sometimes we are not able to surgically remove your fallopian tubes if there is a lot of adhesions, or we are not able to approach at keeping your safety as the first concern. So in that case, clipping or disconnecting is also a good option. That is okay, that is fine, not a problem.
Just as you mentioned, doctor, like about the cesarean processes and everything, is there any natural way to do that? Like, they can be it can be a treatment when the blockage is small and it's not a severe condition. We can start the natural way or natural process for that.
If the blockage is minor, if there is an initial stages and the blockage is very light, then you can always use SSG or something like that, which can clean up the simple mucus things, and you can get pregnant. But yes, if you ask me if it is a natural way, then obviously scientifically speaking, I would say no. Scientifically speaking, there is no way to get it done. But yes, as a precautionary measure, you can always ask. We can always, as teenagers, or you can always have, hygienic methods to avoid infections, avoid using public toilets, because they are the most common cause of getting an inflammatory disease or infections to your body. Because female genitalia are exposed to these kind of infections very easily. So right from there, if you have awareness, then yes, you can help. You can help yourself or others also to avoid these kind of infections.
Okay, we have another question. I'll just pop.
How common are blocked fallopian tubes? It's very common. It's very commonly seen these days. The statistical data, I would not say that it is uniform, but in a country, in developing countries like India, we have seen tuberculosis as the most common cause of getting an infected fallopian tube, and you may find somewhere 30 to 40% of the cases wherein the tubal factor is responsible for a infertility status. So it is actually seen when, if I say that I see 50 patients or 100 patients, then out of them, maybe 40 or 50 will be having, 30 or 40 at least will be having a blocked fallopian tube. So it's fairly common. It's fairly common.
So, doctor, just to understand for a normal, girl, like today working professionals who are females who are planning for, a planned pregnancy or the fertility issues everybody is facing because of the lifestyle or anything. So, because this can lead to, as you said, blocked fallopian tube, and it's a kind of a very severe thing to do. So, for that, for a working professional to any physical activities or any other things you can suggest for working professionals, especially women, you know working the
See,
under the once preparing for fertility and everything.
See, I always say that there is a biological clock which is ticking in all of us. Okay, all the females of the world, they have to undergo that biological changes which happen to our body. So in this era, we all, like, females are, we are all career oriented. In that case, if you are planning to delay your pregnancies, I would suggest get your fertility checkup done, get your ovarian reserve tested, get your tubes checked, get an ultrasound done to get your uterine conditions, and get your partners also checked. Okay, if all the parameters are within normal range and you want to further delay your pregnancies, you can wait for it. There is no problem. But in case you find that yes, you have a low ovarian reserve, or you have a blocked fallopian tubes, or your uterus is not fine, or there is some problem there, or the semen parameters of your husband are not doing good, in that case you should definitely take a step forward, especially for females, because we are age bound. If females are age bound, we have reserve, ovarian reserve, which is limited, and it keeps on from 30 years of age your eggs start declining in number. Okay, so you have to keep that in mind. For any XYZ reason, the most common being your career options or your career goals. If you want to delay your pregnancies, or you want to focus on your career and everything, then in that case I suggest, if you are married, go for a frozen embryos. You just go and freeze your embryos at least. You can delay. That is completely respectable. You can delay your pregnancy. That is not a big problem. You can freeze at the right time your eggs, your embryos, so that you can use them later in your life. You don't have to go through the difficult procedure of the egg donation program or something like that. So in that case, you can do that. Or if you are unmarried, or you are still don't have found the right partner, in that case, for girls who are planning to delay their pregnancies or their marriages, they can obviously freeze their eggs, so that later in life, after 5 years or 10 years, also if they want to plan a pregnancy, they can do it with their own biological oocytes. So that is my suggestion would be, go and get it checked. This is very important because infertility is increasing like anything. So awareness amongst younger population is very important. especially in this era wherein we are seeing young population getting into the lot of smoking and alcohol, and all these things are very commonly seen these days. So particularly from that point of view also, because all this is going to damage your fertility level, your status. So you have to understand, we all have to understand those things. Take a step forward so that you don't have to face problems later in your lives.
Correct. One more question we have. It is yeah, there on the screen.
Ma'am, I had a negative TB test from laparoscopic surgery, no endometriosis I have, then how I got PID. See, your PID is pelvic inflammatory disease. Like I told you, it can be from multiple resources, multiple sources. It can come from your partners also. Like I told you, the chlamydial infection, the gonorrheal infections. Like I told you, using of public toilets also subject you to all kind of inflammatory diseases. Okay, so all these smaller organisms which are not visible through eyes can give rise to. I'm not telling that only tuberculosis is the reason or any endometriosis is the reason, but these small subtle infections can give rise to blocked fallopian tubes. So from where you got that nobody can tell you, but yes, these microscopic organisms can come from anywhere. So that is why it is important for all of us to understand the importance of cleanliness. Okay, maintaining a clean hygiene protection is very important.
Okay. I think we are closed with the questions.
We are
Somebody
done with
just
the
said very
timing
good.
also. Okay, thank you so much. Thank you so much for everything. We'll get back to you soon with some more sessions, some more interesting sessions in the following series. So, if you have any questions or you have any special doubts in your mind, we can always put into our channels. We can come up with the topics of your choice in the subsequent episodes. Thank you so much.
Thank you, doctor. It was great. It was great talking to you. Thank you. Thank you so much.